Hi everyone, in this video I am going to give a update on what happened to me with my thyroid lesion related journey and also talk about certain elements related to allopathic medicine or generally practiced medicine in the world, as well as some additional new elements related to healing that have been introduced in the world for have been also present in the world for many decades or centuries, but certain elements of healing has is currently getting reintroduced into the world. And I want to talk about what I did in my thyroid journey, both related to modern medicine related practices, as well as why in certain places I couldn't use modern medicine, and why in certain places I had to think about alternative, preventative, or supportive care. So, some people consider some of the topics that I'm going to discuss here as new age philosophy or new age mumbo jumbo ways of healing and may not resonate with it. If you're not resonating with it, do not see the complete video. But if you are frustrated with whatever's kind of treatment or therapies you've been getting for your current illnesses, people have to start maybe changing their perceptions and belief systems on these practices that have been existing actually on earth for many decades, or even some of them are also century old practices. But it's just that it's a very hidden practice. That's why most people don't practice it, most people don't understand it. And in order to even understand it or accept it, it's not a one stop suddenly journey towards these practices. It is a slow step by step journey towards these practices. So let me first briefly introduce what happened with my thyroid journey. When I was in US and almost like 15-18 years back, at that time I had gone to see a doctor for just normal health checkup, and maybe I had some minor symptoms related to some illness like flu or something. And while doing the normal health checkup, she had seen something here, so she touched these areas to see if some growth or something is there. And while seeing whether there's any growth, and she was an internal medicine doctor in US, so when she did the checkup, she felt there might be some nodules here or some growth here, and she wanted to ensure that they are not anything serious. So we did a ultrasound. Ultrasound showed a particular size, and at that time, I think she just said whatever, they were all small sized nodules. A few nodules were found, and I think she said after 6 months or a year or two, do another checkup. I don't think she said 6 months. Maybe she said year or two, do another checkup. And I'm also not a very procedure oriented person or very hypochondriac person, that if a doctor says do a checkup in 1 year, when I say 1 or 2 years, if a doctor says do a checkup in 1 year, if that health problem is not doing anything to my body, I don't want to unnecessarily subject my body to any checkup. So even though she said maybe do a checkup after 1 year, I didn't do a checkup after 1 year. I did the next checkup in 2 years. At that time, some nodules had increased in size. So they did a biopsy as well, which is called FNAC procedure, fine needle aspiration. And in fine needle aspiration, a very thin needle is used to pierce and extract the contents of these nodules. And when they extract the contents of the nodules, they are then given to a pathology lab to check under the microscope whether any of these samples that have been taken out, whether they have any cancerous condition in them, or whether they are just simply benign growths. So the result at that time, almost maybe over a decade back, at that time the result said they were all benign. So I was very relaxed. I didn't think I have to bother too much about it, and I actually almost completely forgot about it for many years. The reason I forgot about it, I was busy with studies, I had other life problems going on, I moved countries. So for minimum 5 to 8 years, I not been a hypochondriac and not also overly focused on health. I was only doing normal health practices like eating good clean food and trying to minimize consumption of whatever is considered as junk food, going to gym regularly. And when I moved to India, after trying out the gym and some aerobic classes in India, I decided that I would just rather go out for walks. So either go out for walks or do at home Zumba exercise. So I was very exercise oriented in a way that not high intensity exercise oriented, but I was always for the last at least a decade of my life, I have been doing moderate intensity or at least light exercise regularly and weekly, at least 4 5 days a week. That is what I used to do for many years of my 20s to 30s, until I slowly started falling sick in my late 30s. So at that time, when I was falling sick, I was getting intense hair fall. My skin tone had changed, and I had symptoms which later on, after 6 7 months of going through those symptoms, I correlated that those symptoms could be very similar to thyroid storm or cytokine storm like symptoms. And at that time, I also remembered that I hadn't checked my thyroid in so many years. So when I went and did a checkup now, after almost like maybe 8 to 10 years gap of not having checked it at all for many years, first the doctor I met, she was not very well versed with these kind of issues related to thyroid problems, even though she was an endocrinologist, which pissed me off a little bit. And she was completely, during that time it was a COVID time, so in her mind COVID was taking a primary some primary role in her decision making process. So she didn't ask me the right questions. She was not she was asking the right questions in terms of, yes, doctors are taught to ask patients what are your recent symptoms, but what doctors don't realize, even if you're asking patients about their recent symptoms, sometimes there are patients like me who are busy or doing certain other things in life, or who are very shy or less insistent on going to a doctor again and again for any health problems. So sometimes people can suffer through a symptom for many months before actually going to the doctor. And at that time, I was going through two different kind of health problems or multiple health problems. I didn't realize I was going through multiple health problems, but I was having not simply the thyroid aspect related symptoms, but also allergy and organ damage related other symptoms as well. And my most recent symptoms were related to organ damage related symptoms, some related to skin, some related to heart. And I told her those symptoms, and I wanted to tell her about my thyroid symptoms, but she kept interrupting me. I just want the recent 1 week symptom. And she was not ready to listen to my past symptoms of thyroid related symptoms that had been occurring continuously for at least a year by then, and or more than a year. But my recognition of those symptoms happened about a year or 8 10 months before I met her. And in those recognition also, my realization that those symptoms might be a thyroid related issue also occurred very much later. So I didn't, and even though I'm a pharmacist or who has clinical knowledge about all these diseases or disease related symptoms, I haven't been practicing as a pharmacist for over a decade. So when I haven't been practicing as a pharmacist for over a decade, I've forgotten many things. I'm also not like, I was also a very standard pharmacist. I was not a very great high level healthcare professional. So there are things like this that I understand. When even though I was pissed off with her, I could understand why she doesn't remember certain things, because she's likely only seeing the normal thyroid patients who go to her for high thyroid, hypothyroid, or hyperthyroidism. So when they are going for these two main diseases, they're not looking at thyroid cancer, potential thyroid cancer, or thyroid plus other organ related concurrent comorbidities that are present. Those deep diving practices she's not doing, especially because she's a new level doctor. Now that is the thing, like when I was a new level pharmacist, if I don't know many things, that's okay. But as I'm evolving as a pharmacist, slowly, and universe does this to all of us in any job we do in our life, that whenever we are at the introductory level of a job, like we are doing a job for 3-4 years or 4-5 years, in that it sets up the pace for how good we will be at a particular kind of job. Now, if you don't have an ego, you will understand that if I am doing a job at a level that I'm doing, I am either going to be average person practicing that profession, below average person practicing that profession, or above average person practicing that profession. In order for any doctor or pharmacist to be above average than the normal in practicing that profession, what happened with me also was, when I'm seeing only normal hypothyroidism related patients, I'm counseling them related to that. I'm not counseling them about any of the other thyroid anomalies, thyroid storm related diseases that can happen to anyone, thyroid cancer related diseases that can happen to anyone. So I'm not counseling patients on any of those things, because I didn't usually see those kind of patients in my normal life. So it does take a while for us to get introduced into a new topic or new paradigm of healthcare that we are not seeing in our standard patient population. But if a doctor or a pharmacist or anyone keeps, if you are a average level or say the baby level practitioner, where you are practicing at maybe the primary level of healthcare provision, or you're only treating the basic, very immediately evident patients, at that time you're going to be a primary level practitioner. But slowly universe will send you some high level patients, and when you see those high level patients, if you evolve according to those high level patients, then you will become a higher level. From primary level you will graduate to being a secondary level practitioner, where if she's only been treating hyperthyroidism and hypothyroidism, now she will start treating someone with other thyroid problems, where goiter or other excess thyroid functioning related, metabolic changes related problems are showing up in a patient. Then if she becomes like a university level practitioner, then she will understand when someone has cancerous conditions, what kind of symptoms cancerous conditions will manifest in patient's body, and if unusual symptoms are manifesting in patient's body, are there 2-3 different illnesses going on with that same patient. That is a university level or higher level practitioner will start developing that knowledge. So I also was like her. So I didn't have a grudge against her in the sense that, oh, she's ignorant and that's why I don't want to go. But she was just very rude to me. And if I didn't have my old prescription from another doctor from US, that too, she would never have even checked this area. After checking this area, she felt, okay, let's do a ultrasound. So then I did an ultrasound, and when the ultrasound happened, the next step I knew was FNAC. So even though I had an option now to go back to her or go and find another doctor, at the time when they were doing the FNAC, well, she was pressing the detection device against my throat. While the device was running against my throat, there was tenderness in my throat area and towards the left side of my throat. So when and left, and also a little bit more closer to the parathyroid organ. So two doctors were consulting at that time. One doctor was like, maybe it's just the tenderness of the parathyroid organ, it might not be cancerous. But the main doctor who was doing the testing, she felt there was possibility that it could be cancerous. That's why she then told me to go and get a FNAC done. And even though I now had a choice to take all my tests and go back to the doctor who had seen, I didn't feel comfortable going back to her, because I just couldn't trust her, the way she handled the questions, the way she didn't even listen to majority of the symptoms that I had practiced. Like, because I also know that when you go to a doctor, sometimes you forget to tell all your symptoms, and which is what happened to me. I forgot to tell about the hair fall symptom, which was a recent symptom, and I also forgot to tell about a past symptom of 6 to 8 months or even 1 year back, when my skin wasn't looking like this shiny and wheatish or fairish in texture or tone. Instead, it was very dull looking, it was very darkened skin, and it was a very odd skin texture considering that it was winter time. In winter time, usually my normal analysis of my body is in winter time I have this kind of a skin, or when I'm not doing any outside home activities and not going out in the sun too much, that's when my skin stays this kind of a color. Whereas if I am going out in the sun a lot, if I am going on summer vacations or being out in the sun for a couple of hours, immediately my skin starts tanning and I will get a darkened skin. But that darkened skin that I'm getting during summer time or high intensity sunlight exposure, when that high intensity sunlight was not even present for a few months during winter time, and I was not even in Mumbai. In Mumbai during winter time you have sun exposure, but I was at that time in Kolkata, and in Kolkata there is no intense sunlight happening in the winter time for a few months. So in those few months when there is no intense sunlight, it was very strange that my skin had these darkened texture, and it was clinically very similar to something called the leathery skin. And that leathery skin type happens to you when you have some thyroid problem manifesting in your body. It could be a thyroid cancer related problem, it could be a thyroid organ function related problem. So I knew that was a potential problem, and I wanted to tell her about that, but I couldn't tell her. So I didn't want to go back to her. But I also knew because there was tenderness happening here and there was a cancerous potential. So I went directly to the hospital where I knew that the ultrasound hospital only recommended where I can go and get a FNAC done. So when they recommended a hospital where I can do, because not every hospital has all the procedures in India all the time. So even though I went to one hospital for an ultrasound, for doing the FNAC I had to go to another hospital. So when I went to that other hospital, again looking at my report, their technician or the person who sets up the appointment was a good technician, or appointment was a good healthcare practitioner. She may not be having a medical degree, she may not be having a education in other than basic science, any other education, but she was a very well aware and conscious healthcare professional. And I'll call her a healthcare professional because it doesn't matter whether you're a doctor or a simple assistant to a doctor somewhere. If you are practicing good healthcare, you are a healthcare, or good healthcare practices in your work, conscientious work practices, you are a good healthcare professional. So because of that girl, she saw the report and she saw that in the report there was a potential for a cancerous condition in the patient. She immediately tried to convince her the people who do the FNSC to get an appointment set up for me. So I got an immediate appointment, and when I got an immediate appointment, they did the testing, and within the place where the hospital faltered now is there is no system in that hospital to contact the patient after a report has been generated. And there was a puzzling aspect to that report. Because there was a puzzling aspect to the report, I think the pathologist got confused, and again, if you had asked the right questions either to the patient or to the person who was doing the procedure, you would have found out why that anomaly had popped up in the report. So I waited and waited for at least 2 weeks, and then I decided 2 weeks is enough time for them to have given me a result. In the past in US, I had got back my result within a few days. So I asked for the result. So at that time, I got a result where there was a question mark in one anomaly of the report. But the report related to the thyroid showed it was a lesion. One of it was a benign follicular lesion, and the rest of them were nodules. So, or at least that is how I interpreted the data, because you have to realize, like, say I have 10 nodules growth. Nodules are like pimple-like growth inside the body, not outside. So they are pimple-like small growth inside the thyroid area. And these pimple-like growths in the thyroid area are, all of them are like a pimple, but how sometimes when a pimple bursts, we have an open wound. One was like an open wound like that. Now that is what the report was saying. And how the ultrasound also, when I was looking at the ultrasound report also, that is how I interpreted a ultrasound report. Now my training is not involved in ultrasound reports. I do have some pathology related training in from different pharmacy schools in India as well as in US, but I do not have any education in reading a ultrasound report. So all the interpretation I did from the ultrasound report came from just doing a little bit of a Google search and scientific search on these terminologies, and from which I interpreted that most of them were nodules and one was potentially a lesion. Now, with the lesion, there was a pain involved in this area. Also, I observed in the meantime that whenever my phone was in low charges, my phone used to get very heated up. So, the radiation from the phone that was getting emitted when the phone is like 10% charged was high. So I also started observing that, and in my particular phone, there was a distortion also happening when phone goes in distortion in noise, like when you're talking to someone or listening to music, there is a frequency distortion that happens in the phone when the phone was lower in charge. And that distortion, I realize, is happening because the radiation is interfering with the noise frequency, and that same radiation sometimes would also, the heat that is emanating from the phone was causing some pain here. So that's when I started, and there have been past studies with inconclusive data that have shown that radiation from the phones can impact people's health status. Now, even though the data is conflicted, because there is a potential for radiation to impact people's health status and can potentially lead to cancerous condition, at a time I decided it would be safer that every time my phone has lower charge and higher heating and radiation emission possibility, that time I shouldn't use my phone. So what I started doing was, when my phone is above 80% charged or above at least 60% charge, that is when I was talking on my phone. That is when I'm using my phone for listening to something on YouTube or listening to music. And I was doing a lot high amount of phone activity, because not having any professional work life for a while, not having also many personal life interests also, my best friend, or my way of entertaining myself has been a use of a phone. Then I wasn't even using TV also for a few years. So every entertainment related things, like many people on average watch TV for 1-2 hours a day. Instead of that 1-2 hours of watching TV on TV, I was watching 1-2 hours of TV like content on my phone. I was also, if I used to love reading books, so I would watch books. I was also getting pulled towards other esoteric practices related to energy healing, so I would do some energy healing related things also on my phone. So everything, like almost in a day, 8 hours I'm sleeping, 1-2 hours I was doing normal life functions, or 3-4 hours normal life functions. Remaining 12 hours of the day, or 10 to 12 hours of the day, I was constantly using my phone. So is it very likely that if my phone is emanating, now here also those who do research on radiation related impact on people's health need to start becoming mindful also about the research aspect of this area, because this is where I did learn to understand how radiation was impacting my health. And I began to realize that, say there are 100 people in a particular society who are using phone from the same brand and also the same provider, cell phone provider. Now all of those 100 people who are using the phone from the same brand, same phone and same provider, at that time one person who is using the phone for 10-12 hours a day is going to have the maximum radioactive exposure, whereas on the same 100 people there could be 90 people who are only using their phone as a phone. So they might be using their phone only for talking to someone for 1 hour in a day, or they could be maximum using the phone for 2-3 hours of some listening to music, doing some meditation, going and talking to a friend, and that's it. So maximum their use of their phone is 3 hours. So now those people who are using the phone for only 30 minutes to 3 hours, will their radiation exposure be much less compared to someone who is using the phone 3 to 4 times or even 10 times more hours than them, right? So the longer you use something, the longer is your exposure to the radiation. Secondly, now if there are two people who are using the phone for 10 hours a day, but one is constantly keeping the phone charged and there is no heat emanating from the phone, no high radiation from the phone, will that person's health be a better quality health than someone who is using the phone for 10 hours, but in the first 3-4 hours the phone is above 60% charge, but in the last 5 to 6 hours the phone has lower battery life and they are getting exposed to radiation during those remaining hours that they are using the phone. So all these elements also lead to a contradictory data emerging when people are trying to research and figure out whether something harms people's health. But when will majority data related to radiation harming someone's health, radiation causing cancer, radiation causing other health issues emerge actually in a patient or in a patient population? When people were only using cell phones like for 1 hour a day, or very small segment like 10, 20, 30% of our population is using a cell phone, that data may not emerge. But when billions of people are using a cell phone of a particular brand and globally, then a global data will start emerging about the benefits and harms of such things. And even if you want to hide the data or deny the data, if there is some health harm involved, that health harm eventually will emerge when mass scale people are using products where health harm is present in usage of that product. So for me, I started doing these practices. There was a reason why I didn't go and do medical therapy. Like, I had a choice of seeing an oncologist. I did a research work on what are the basic therapies an oncologist might practice when a lesion is found, and I found there were two choices that a oncosurgeon will mostly recommend. And I also have this understanding, intuitive understanding of, based on someone's education level as well, or their title, what kind of work they will do, because that is my knowledge about healthcare. So I know what kind of work they'll do. If you are a layman, you may not know what a oncosurgeon does versus what a regular internal medicine doctor does versus what a some other kind of oncologist does. Each of the oncology related professional will have a specialty, and if they have a particular specialty, based on that specialty, they will push for what they have learned is the basic therapy that is predominant for that person to push for, because they are also trying to earn money. They are also learned only that skill, and they are not looking at other ancillary skills also. Sometimes if you are a baby level, primary level, basic level doctor, you will only push for the primary level thing that you have learned, and that's it. You will not do the deep dive that based on patient specific factors, patient specific health conditions, what kind of therapy should you provide. And India, every time I have met a doctor, both in my personal life and in as a patient, I have realized that very few doctors actually have this skill set of understanding the deeper elements of practicing medicine and the elements related to something called evidence-based medicine or patient-specific medication therapy management. This thing is something that I have learned in US as a PharmD student, and I know some doctors in US also practice this. I don't know if majority doctors practice this, but definitely doctorate of pharmacy students, those who work collaboratively with doctors in US, those pharmacy students who are involved in clinical decision making processes for a patient's health, they do this evidence-based practice of medicine on a patient. And they usually, in US, it started with doing this practice in elderly people or people living in long-term healthcare facilities, nursing facilities. But it's not just limited to doing the medication therapy management for elderly people. You can do it even for younger people, especially if someone has a complex set of diseases or complex set of health problems manifesting in their health. So having this awareness, should I use the awareness that I have about healthcare on me, or should I wait for a doctor to help me? Isn't it, say you are drowning. If I know swimming, should I swim, or should I wait for someone to come and help me swim when I know swimming and I am capable of swimming? The only time I will need rescue if I know swimming and I'm drowning is when knowing swimming, I'm not able to move my arms. There is something happening to my health, that maybe my arms got paralyzed, or my muscles are not functioning the right way, or my legs got tied in a seaweed or something while I was swimming in the sea, or there's heavy tide and whatever swimming capacity I have, I don't have the strength to fight the tide. In all these circumstances only, even if I know swimming, I will need external help. But, and who else will need external help? Anyone who doesn't know swimming, who doesn't have even the basic capacity to swim, those people also will need help. So when I'm going to a doctor, I have the swimming like knowledge, swimmer's knowledge. The places where I can swim, I cannot depend on a doctor or an external helper to help me mitigate my health problems, right? I need help from a doctor where I don't know how to swim, the places where I don't know how to treat myself, or if their therapy is much more beneficial to me, considering the risk and benefit factor. This risk benefit analysis I had to do for myself, because I was having heightened allergies at that time, heightened inflammation at that time, and the two procedures that would have been commonly recommended by an oncosurgeon, one was injecting a drug there to heal that wound. Second would be to actually just remove via surgery some chunks of the organ system there where they are finding that nodule, and that nodule was deeply embedded in between my thyroid parathyroid organ area. That much I had understood when they were doing the ultrasound testing. So there was a risk that if he goes and he's not a very careful doctor, there is a risk that if he removes, first of all, I do not like the concept of removing any organ from anyone's body. So even for the sake of saving someone's health, very rarely I will support removal of an organ. Very rarely. Like if 100 people are there who need to remove some organ for certain procedure, my intuition says at least 90-95% of those people do not need organ removal. They could go for some supportive therapy first before deciding on whether they should go for an organ removal. So I got scared, and I know, like, if any part of my organs got removed, there will be a health risk involved. So I didn't want to do that. Secondly, because I'm in a heightened allergy state, I was in such heightened allergy state that any kind of metal was also irritating my skin. Like, I have worn gold jewelry all my life. I've also worn artificial junk jewelry all my life. So despite wearing gold jewelry and junk jewelry for at least 35 years or 40 years of my life, I was getting heavy skin allergies. Even here, can you see the darkness there? That darkness is still the allergic response to wearing some gold item even recently. So what is the learning lesson from that was that when you are injecting a drug, you will be using a metal to inject. When you are doing a surgery, again you will be using a metal surgery instrument to cut open this area. So both of which would be a health risk for two reasons. First, I'm already in a heightened allergy state. So when you are in a heightened allergy state, even microscopic amounts of something that your body is allergic to can lead you to go into death. There are so many patients, people don't realize it, that after surgery or during surgery, they may get respiratory arrest, they may get cardiac arrest, but many doctors may have put two and two together, I don't know, but my understanding of it is, if I have an allergy, I can also go not only into cardiac arrest or respiratory arrest because of surgical procedures being done in my body, but I can also go into these cardiac arrest, respiratory arrest when I'm getting injected by a drug, or when someone is using a metal to cut open my body, or when they are also using a metal to stitch back the wounds. There are so many places cases where metal would be used if I would have chosen a surgery option or an injection option. And the things related to injection and allergies I knew better, because in US I was also a immunizing pharmacist. So I used to give flu shots for the regular bird flu to patients in US. I used to give pneumonia shots and couple of different medication that are vaccines. As a pharmacist, our pharmacy had the license and I had the certification to give those vaccines to patients. And from there I learnt about the harms related to allergies, harms related to when you are injecting someone with any drug, where you have to do sometimes a risk versus benefit analysis. So I did my own risk versus benefit analysis before even seeing a surgeon, because I am educated, I know how to swim. So I have to first use the swimming capacity that I have before I go and meet someone who can help me when I am stuck while swimming, right? So I need a surgeon who who knows that I know how to swim, and then he has to figure out why, despite knowing all these things, where they can help. That kind of a surgeon or that kind of a doctor is what I was looking for. I also had limited finances at that time. I was going through some financial, I was forgetting all my bank passwords, my cards had got stolen. So even though I got a new card, I kept forgetting my passwords. So because of which, and this was a very universe setup block for finances also happening for multiple other karmic reasons in my life. Because it was a time for some family who have pretended to care for me to step up in the right way, and unfortunately they couldn't step up in the right way because they were living in heavy denial of multiple things. Not just heavy denial, they have this illusion. There are some people who live in illusion in their life that they are caretakers or they are providers of people, when they are actually not, because the real crunch time shows who is a real provider, who is a real caretaker. And in those crunch time, none of them were ready to help in the right ways that I needed the help. So again, if I don't have health supportive conditions in my home life also, do you think a surgery would be beneficial for me? I go and do a surgery, I will be in the hospital. When it is a minor level surgery, I won't even be in the hospital for too long, maybe 1-2 days maximum, or it might be a couple of hours procedure or something. I don't know the duration of a thyroid related procedure and whether they let the patient stay or whether they ask the patient to leave after the surgery. Whatever is they will do, even if you allow a patient to stay for 1 or 2 days, or you just do a temporary a few hours procedure, monitor the patient for a few hours and then let them go. Whatever you do, you the surgeon may be doing everything best related to the protocols that is set up in the hospital setup or in that typical clinical setting of surgery policies and procedures. But what surgeons or any other doctors don't realize, patients' home conditions are also very crucial aspect of patients' healing after surgery or after hospitalization. And this aspect I was learning slowly that I didn't have any, I had some problems in my society itself, where I had a own home. In that own home there were some societal problems where I was not able to convince the society that using pesticides is harmful, there are better health alternatives to using pesticides. So all these problems were cropping up there, so I didn't want to stay there. There were other problems also cropping up. This was just one aspect of the problem that was harming my thyroid health. So I left the society. When I was living with my dad and brother, they had other set of problems. So all these made me realize that my recovery would be harder if I go into a very surgery oriented step. That's why I didn't take that step. Instead, I started focusing on what I knew how to swim about, did my own research work on what are other things I could do. One was intuitively guided to me that the radiation from the phone is causing this pain to increase. So I stopped, as I said, I stopped using the phone for long hours, or if I was using it for long hours, I ensured that the phone is above 70-80% charge always, so that there's no hot radiation emitting from my phone. That was the one thing I did. Second thing, because I was going through the thyroid symptom storm related or cytokine storm related symptoms, the one key indicator of thyroid storm or cytokine storm is you will be always very heated up, and when you're going outside in the sunlight, you will be finding it extremely distressful even in normal sunlight conditions. So what I started doing, I started avoiding the sunlight. I couldn't go out in the sunlight when it was extremely hot. I would choose like days, either go in the evening time or early morning time, than choose to go out in the afternoon time in the really hot sun phases. So that sunlight radiation from the sunlight also I reduced, because again that is also a form of radiation that can impact our health if we have got a radiation impacting health condition going on in our body. Then the third radiation that was also bothering my health was radiation from these LED light bulbs that we use currently all over India. These LED light bulbs now, again, what happened when I was living in my own home, because I was living alone, there were days when I would just switch on the light, and just to have some light gives you a false illusion of company sometimes. So to have that false illusion of company, I would keep the LED lights on for 24 hours. So I had a 24-hour cycle of exposure to LED lights for many days, and that was also potentially escalating my thyroid problem. I realized that LED lights were causing thyroid problem when there was a certain day when even just standing 10 minutes in the kitchen while I and my cook, sometimes my dad's cook, sometimes we used to converse together, and while conversing with her, sometimes I used to even cook together with her. So in those moments I realized even 10 minutes of LED light exposure plus heat from the cooking, both were giving me very extreme physical distress that I wasn't able to take. So I realized it is the LED light, because when the cook was also not there, I was not even doing heavy intensity cooking, just 5 minutes, 10 minutes of maybe like flipping a omelette like thing. Even in that 10 minutes of cooking, I was getting problem with that LED light. So I stopped exposure to LED light. Stopped meaning I tried to either not use the light when my body is showing extreme heated conditions. I tried to use outside sunlight in the homes where I lived, where sunlight access is possible. I was not using the light. If I'm doing a function where I don't need light activity, if I'm just watching my cell phone and I don't need access to external light for doing anything, I will not turn on the light. If I'm doing an activity that needs light and sunlight is not entering the home and in the daytime, then I will turn on the lights in the daytime. And otherwise, like if I'm writing, if I'm painting, if I'm knitting, because these were the activities I was doing at home life at that time, or cooking, in all of these activities, if enough sunlight is there, I will not turn off the lights, or I tried not to. But if there's not enough sunlight, I will turn on the lights for longer hours. So I reduce my exposure to these LED lights, and that definitely helped with my thyroid symptoms. The overheating I was feeling, the skin irritation or burning sensation that I'm feeling, all these subsided because of the less exposure, to reducing the exposure. Like instead of those 24-hour exposure, and in some homes where there was no sunlight, I had maybe 18 to 20 hours exposure. Whatever number of hours of exposure I was doing earlier, over 18 hours, I started reducing and tried to make it less than 10 hours, less than 5 hours also if possible. So depending on where I was staying and what access to natural sunlight I had, because if you have a choice between radiation from a LED light versus radiation from the sun, radiation from the sun is a healthier choice, because in the radiation from the sun you might get exposure to vitamin D. The radiation from the sun, there are other, sun being a natural source of light, gives us more positive health experiences than a unnatural source of light or radiation. this difference I understood. So I started practicing all that. So while I started practicing all that, slowly the heated sensation related, hair fall related symptoms started going down, because pesticides were also possibly involved. Pesticide exposures were involved in causing these nodule formations. I also observed that this area's lumpiness had gone away over time when the exposure to pesticides from the external environment were less. The pain also subsided in this area where I had the lumpiness and lesion. And if you are doing energy healing or getting knowledge from those people who not only do energy healing but are therapists and healers who work on the aspect of pain that arises in our body as a result of chakras and energy systems being imbalanced in our life. So when you do those kind of teachings and readings and healings, you will also understand that when you have a thyroid related problem manifesting in your health, it is a throat chakra imbalance or suppression related issue. So when you have a lesion, it also means someone is oppressing your voice. That is when you are more likely they're piercing your voice. Like whenever you're expressing something, someone is there attacking you and not allowing you to be your authentic self. And that experience I've had for 30-40 years of my life with multiple families related or social interaction related experiences. And those had actually escalated in the last few years when I was trying to convince people about certain things related to healthcare that I present in these videos, but people in my personal life were in denial that that is a relevant experience. So they kept pushing back against whatever I am trying to voice. So when you have voicing something and someone is blocking you, or actually not just blocking you, they're cutting off your voice, that is when you are more likely to have a lesionous experience related to, for me it was related to throat chakra. Say you have a heart chakra problem where you are a heart centered person and you are using your heart chakra to express something. Again, if you are with an open heart, you are trying to express something and someone is piercing you in your heart chakra, at that time you will have a closed off or hurt heart chakra related experience then. So everyone needs to understand, it may be energetic experience of a wounded heart chakra, or in their heart also, maybe the people who are born or later on when they get hole in their heart, that is a physical manifestation of an actual experience that's happening in their life where their expression of openly being authentic was getting pierced by emotional or psychological related heart chakra manipulations. And there is also a third reason where actual physical chemicals can also cause these lesions to form, which is when if you have ulcers, when you have stomach ulcers, you will observe many people don't know this, but stomach ulcers can happen after exposure to arsenic in your food. So if you have consumed arsenic related food, you can get stomach ulcers, because that's a physical toxin that has the capacity to burn through your skin, burn through your body's cells, and then cause a physical lesion. So there are physical aspects that can cause lesions to occur in our body. There are chemical aspects that can cause lesions to occur in our body. There are emotional, energetic aspects that can cause lesions to happen in my body. So when I am removing all the sources, what I started doing, that's why I started speaking openly. First, I started expressing myself when I'm getting a pushback on people not understanding authentically any of these things that I'm discussing in any of these videos. When I'm getting that pushback and getting pierced whenever I'm trying to say something that is relevant for them to understand, that's why I'm saying it. I'm not saying it because I just love speaking. I have lived years of my life without speaking to any humans, so I have the capacity to not speak at all as well. But when there is a need of the hour, when I see that there is a need, I speak what I feel is the right thing to say, even if it may be conceived as something very different from the norm. The norm doesn't decide what is the right need of the hour. The right need of the hour is decided by what is actually the need of the hour, and someone's perceptive ability to understand that is the need of the hour. So I realized, like, and I got also guided by the universe, that if people in your personal life are not willing to listen to what you are trying to express, or in your social life are not listening, you have to tell it to the world, because it was something relevant for the world as well. So I started making these videos, and before making these videos, at that time when I didn't even have the healed throat chakra, because I was having a throat chakra problem, I was having a thyroid lesion problem, so at that time, and I was having a cancer like situation going on, and multiple other health problems going on at the same time. So I was so weak, I couldn't move from the bed, I couldn't do much physical activities, and instead I started typing, that's why, and writing on these issues first. So the first few years, when physically I was not able to move much, I was doing the writing activities. And then when I was doing the writing activities, I also got guided, and I was not focusing at the time on energy healing. Even though I had learned the paradigm of energy healing, I was not focusing on doing that. So because first I was trying to figure out all the physical elements that are adding to the health harm, because those physical elements, even if I go to a doctor, even if I go and get an energy healing, what is necessary after energy healing? If you do an energy healing, if you take a medicine, if you are in recovery from a surgery, if you are in recovery from a major health incidents, or if you are in a moderate health status where you need medicine and some nutrition, everywhere you need clean nutrition, clean food, clean water, clean air, clean home environment, people ready to help you, support you when you are in bad health, or if those people are missing from your life, at least a place where you can recover in the right health aligned manner. These are the elements everyone needs to have a complete recovery, proper recovery, healthier recovery from any moderate to severe illnesses they are going through. When we are in a mild to moderate phase of poor health, at that time, if some of these elements are missing, you can still recover, because you're in a mild to moderate state of health. Your body will take a little longer to recover, but it will eventually recover. But when you are in a moderate to severe status of health, at a time, if many of these factors are absent, it will take you longer to recover, it will be harder to recover, or sometimes people might even die if the right health supportive factors can't be present in their life for various reasons. And which is what these videos are about, that if we have a lot of water pollution in energy healing, after energy healing also a lot of water is needed. But if I don't have clean access to clean water, how much ever I do the energy healing, without clean water, I cannot have the right outcome only after doing the energy healing if clean water is absent. Same way with even nutrition or cooking, eating nutritional food. You have to wash food with clean water. You have to clean your body with clean water. You have to cook your food with clean water. Your medicines also should have absolute pure water. Otherwise, again, from medicine also, you can end up having health harm. So all of these elements are important for health. So I started focusing on these physical elements where I don't have to do anything, but I have to ensure at least the cleanest food, cleanest water, most health safe food is accessible to me. And whenever it is not accessible, I do complain to the, if it is a retailer, it is who is giving me a bad product, I'm trying to complain there. If it is a wholesaler, I'm trying to complain there. Wherever I can complain, I have complained. Of course, it's a little bit futile to complain when there is mass scale problems going on, and if companies live in denial that those problems are going on. At that time, I sometimes gave up also on complaining, because first, what needs to be fixed for me at a personal level? For me, it was health needs to be fixed. So I was doing everything in my power to fix my health, but anything outside of my power that is influencing my health that needs fixed, I was also simultaneously trying to address those issues whenever I had the energy, whenever I had the enough resources to or enough right medium to express where the problem is occurring. If they had patient customer service personnel, they read the issue. But if they don't have wise customer service personnel, they might read the issue, but they will give the standard answer of here's your refund and that's it. they don't know how to escalate or understand the depth of a problem, because they are either too young, too immature, too inexperienced, don't have any training related to what is mass scale health harm. And that education only I'm trying to provide via these videos. So because mass scale health harm is going on currently on earth at multiple levels, and mass scale changes are required from individual to corporate level related, or even hospital level related, steps have to be taken, and the right steps have to be taken to fix these issues in the right way. So for my thyroid lesion, I was not practicing energy healing because I was not getting access to good water. So when I was not getting access to good water, when I had gone to see that doctor, she had also given me some prescription for allergy medicine. So allergy medications also, when you take normal allergy medicines, your body will also, when using those anti-allergy medicines also, you will need high amount of pure clean water. And I got into this dilemma of I'm not even able to consume the normal. Earlier I used to consume 2.5 to 3 liters of water daily. When I'm exercising a lot, it would be up to 3 liters of water. When I'm not exercising that much, it would be at least 2 liters of water that I was consuming daily. And I was not even having access to 1.5 liter of good quality water at that time. So because of which I slowly also had gone into appetite loss phase, because water was polluted, and that same water is needed for cooking, and that polluted waters, pollutants that are accumulating in my body are also shutting down some body functions. So all these multiple things were simultaneously happening in the body. So because when I was taking anti-allergy medicine, I'm needing water, and that water already, if I drink 2 liters, I'm not having even access to 2 liters. Now because of medicine, I have to take 3 liters water. I don't have that 3 liters water. So should I take the medicine or should I not take the medicine? My choice was don't take the medicine. Instead, remove all the things that are causing allergy responses to me. So if there are face wash that I was using that was giving an allergic response, I stopped using. There are sanitary pads that are giving allergic response, I stopped using. If not stopped using, I try to, because with sanitary pads also I'm having this heavy issue of one brand I will find which will not have any chemicals in it, but immediately after 2-3 months of trying that product, later on they have introduced scented products, that, which are all highly allergic to me. So I can't use those products. So I've been having like a terrible time with all kinds of allergies from all kinds of things. And though most of my allergic responses, except like a little bit of rashes here, most of my body doesn't show the allergic response, because I have reduced or eliminated use of all increased allergy causing products in my daily life as much as possible. It's not that I can completely reduce that unless we really do have a clean earth. Until then, I can't reduce that. So while I was going through all these phases, and I was also trying to figure out, is there any place other than Mumbai where I can stay, where pollution might be lesser than what it is in Mumbai. So I went on a search and went on a couple of trips outside Mumbai to figure out those places. And every place had some good qualities there, but there were also many allergy or health harming factors present in those places as well. So eventually, after all this, what started happening was, at the time I got some energy healing videos, and one of those healings did end up actually removing completely the pain from this area. So I understood that this thing got healed by itself, partly because of the energy healing, partly because I went to areas where the pesticides from the environment were less, partly because I had started doing all these reduction in radiation related activities, partly because I also started reducing the allergic whatever things were adding to my allergies. I stopped using those products. Because when I use products which cause allergy, or if I use multiple products which are causing allergy, it leads to increased inflammation, like increased heated response in the body. Same thing with the radiation, it is causing increased heated response and inflammation in the body. Both of which then, when there is increased heat, increased radiation, increased allergic related heat in the body, all of which, again, heat will also cause the lesion to escalate or worsen. It may also cause some pimple like thing to suddenly burst. So whatever nodules, other nodules I have, they may also again burst when the heat level is high, which is what I have has now happened. Like while this lesion went away and the pain has gone and nothing related to, I didn't feel that lesion for at least a couple of months or years. Now recently I have started feeling a lesion here. Why? Because I had maybe 5-10 nodules in this area. So out of those 5-10 nodules, some might have got removed because of normal biochemical processes that I started, biochemical processes, supportive health factors that I was doing in my life. And this lesion that was earlier present, it also got healed as I started speaking more and more about these health issues. But there's still a lesion here because there's two things. Again, people don't realize this, but usually our left side and right side can indicate our feminine and masculine energy in us. So say, earlier my feminine energy was getting suppressed by people, and the reason why my feminine energy was getting suppressed by people is because if I talk logically about health issues as a female, people do not like females to be too outspoken. So that's why, even though there was an imbalance in my feminine masculine expression, so when there was an imbalance in my feminine masculine expression, that is when I was getting pierced here and stopped from speaking my truth, because people don't like women to say this is what you should do. So that was causing, it was like I was being a balanced masculine feminine energy holding person, but I was getting perceived as a toxic feminine. So that's why I was getting pierced, and this happened. Now again, there are certain things I've done in recent years where I'm getting perceived as a toxic masculine energy holding person as well. Even though again it is not a toxic masculine trait that I am manifesting, I am just again trying to manifest the fact that I am in danger, because I am literally in physical danger, financial danger. A lot of things are there in my life that has led to increase even more in normal, like this, all these health harms that I've talked about until now, they're all normal people's life related health harm. Anyone leading a normal life on earth is going to experience that kind of health harm. So that is, every normal person is going to experience these kind of health harm in their daily lives. So that aspect I was exploring so far. But there's another aspect to my life where, other than the normal people's experiences, I'm having some mentally ill people's related experiences, socially ill people related experiences that are also getting oppressed by people and pierced by people. So now I have started having a tenderness and lesion like possible manifestation in this area of my life. And see this whitened, I don't know why, but this is a universe's way of pointing that there is a problem here. So again, I have to express my truth related to those experiences where I'm being perceived again as a toxic masculine energy person when I'm not a toxic masculine. I have a valid reason for protesting certain things that I have been protesting about in recent years in my personal life, but to no avail. So because of which I have these pierced throat chakra again in this area, and I have a lesion again. And I will have to again go and possibly do a ultrasound to confirm that I have a lesion here, or confirm that I have some wounding going on here. It may not be a lesion, it could be something else also. So whatever it is, but there is a tenderness here, there is a pain here, there's also all these drinks that I was consuming from outside. Those drinks had a lot of chemical contaminants in them, so it could be a chemical pollution combined related. 2-3 things again are leading to this area's problem as well. So this is the status update on my thyroid problems. And universe, and this extra problem is happening because when you are trying to bring light to some normal things of life, those people will also experience abnormal problems as well, some extraordinary problems. Now it's up to me whether I want to talk about the extraordinary problems. I didn't want to talk about those extraordinary problems. So a little bit of throat chakra operation I was doing by myself also. I was enabling it, that I don't know how to talk about those problems because they are some energy healing related problems, there are some energy manipulation related problems, there are also some real life manipulative people around me, them related problems as well. And manipulation is such that very difficult to talk about covert abuse or manipulation related problems in your life when people don't understand what is abuse, what is manipulation, what is covert abuse. Many people have distorted perceptions about these concepts. So until people start healing and balancing their perspective about these problems, until then I might have this problem, or until I realize okay, people have that problem but I have to still heal this issue, so until then this problem will persist. And yes, I can focus on doing energy healing in this area, but as I said, if I do the energy healing, I need access to water, clean water, and clean water has been a problem, consistent problem, for at least 4-5 years of my life. And everywhere in India where I have gone, clean water has been a problem. Purest water is majority time absent. Sometimes because people are unaware about unclean water, people are unable to keep their homes clean and understand that cleanliness is not about using large amounts of soaps and other detergents and other chemicals, but cleanliness actually is more about doing the right mindful practices to keep a home or a hospital or everything that we generally do in life. In order to keep it clean, there is a right way to do it and a wrong way, and majority of us are practicing the wrong ways, because of which there's heightened pollution, because of which any kind of liquid products or water, bottled water also, if I purchase, it gets polluted sometimes. And or if not polluted, they add all these minerals that not everyone needs those minerals, and certain minerals if they add could also be health harming to certain humans. All these things people have not done, companies have also not done any due diligence in these aspects. So these all add to my health problems, and until they get fixed, all I can do is do the best I can given the circumstances I am in currently in my life. And the reason why I'm not doing an ultrasound even now is because if I don't have peak thyroid symptoms, if I go to a doctor, I'm uselessly using a medical procedure, clinical procedure, where things may not show up, the data may not show up if I'm not at a peak worst state of health. Secondly, in order to prove or disprove whatever I'm saying here, if people really want the proof and disproving of what I'm mentioning in these videos, if you practice these in your own life, you will, and you are someone who is going through these thyroid problems or other health problems, throat chakra problems, you will yourself realize the truth of this by practicing it in your own life. So you don't need actually a doctor's proof or a medical proof to show when your body is healed and when your body is not healed. There are multiple, without diagnostic tests, without diagnostic surgeries, without many more normalized medical practices. If you are self-aware, you can very well come to know when you are healed, when you are not healed, when you are in the journey to healing, when you are in the middle phase of healing, when one healing happened but another place where healing is needed is now being highlighted. So people also don't realize with disease is that now throat chakra problem, thyroid problems will be resolved if you are authentic, will be resolved if you are aligned with your core truth, will be resolved when you are doing healing practices, will also manifest when you are speaking your truth and there are not enough people to understand your truth or believe your truth, will also get healed in the right ways using medical intervention or other interventions or a combination of them, but only when you are aligned with the right ways of healing yourself. The more aligned you are with the right ways of healing yourself, and the more capable you are also of going through certain problems, those are the people who will have the maximum problem. Now, all these problems related to thyroid that I'm talking about, is everyone going to get all these problems? No. But if I got 5 or 10 problems related to thyroid, related to environment, pollution related factors causing a thyroid problem, related to social or patriarchal or other abuse related factors adding to the piercing and nodule follicular lesion like problem, or any other painful experience in someone's body, all of these are manifesting for each of us. Maybe not in all these 5-10 ways that it manifested for me in my last 5 to 15 years of my life journey, but if any one of it is manifesting in your life, if you don't do the right treatment related to what is manifesting in your life, or don't do the right health and risk benefit analysis of what is best given your circumstances, then you will be stuck in the cycle of just spending money in useless things, or in the cycle of spending money for something that you might not need to spend money on, or you might get in a cycle of you have spent the money, you have given all your resources to go and see a doctor to get something checked up and treated, and they have done all the right steps, but the right, if health supportive steps are absent after you come back home, again all the money you spent, all the resources you spent getting a treatment, all the resources the doctor used to give you a treatment will fail, when in the end part, when you are in your recovery stage, all the things, supportive things that are needed to recover you from an illness is absent. Like for me, in order to really recover from all of these quicker or better, in a better way of life, I can again, if I have a lesion, I can again choose to do a surgery if I didn't have heightened allergies. I do have heightened allergies, so I will again not choose to do a surgery. I would rather focus on doing a energy healing. But for energy healing or post surgery recovery, I need good clean food, good clean water, good clean clothes, good clean place to live, good energy of healthy energy filled people, or healthy energy filled food. At least the minimum is food and water and air and a clean place to live. But after that, if you have supportive family, if you have helpful family, if you have helpful caretakers, all of it adds to your experience of health recovery, or the sooner experience of health recovery. But the bare minimum of food, water, clothing, air, and being the cleanest, if that is not available, how much ever I recover, again there will be another lesion that might crop up, again there might be some other health issue. If my throat chakra is healed, but some other part of the body also has some stored energy or stored chemicals from all the years that I have had chemical exposures that were harming my health, those chemicals, when they need to be released, when they need to be healed, when they need to be addressed, then the next problem will show up. So this is also part of a recovery journey of someone. When you are severely healed, when there are 10 factors that were impacting your health, you have to slowly, step by step heal each of the factors at which you are able to heal it, or allow a healer or a therapist or a doctor to heal you in the place where they are supposed to heal you. But after each phase you are going through, you have to also evolve into the next step of healing. So if I was sick, I didn't go to a doctor to address the sickness. That is first step of failure. I didn't even address that I am sick. So there are many people who exist like that. They have pain, they have all these symptoms that I'm describing as thyroid symptoms, but they don't even realize that they are sick. So if you don't acknowledge you are sick, you are never going to go to the next step of figuring out why you are sick. Then there are some who realize they are sick, they went to a doctor, doctor gave them medicine, doctor gave them surgical choices, and after that they are like, okay, I have got the medicine, I have got the surgery done, I'm going to be fine. No, that is not how real healing works. If you really want to heal, just the medicine, just the surgery will not heal you. After the medicine and surgery, you have to have clean water, food, air, clothes, home environment, supportive people. All of these are necessary for you to have the best outcome, best quality life, healthiest life. And this is where the main message of all my videos are: how to take us towards the best quality life possible. But in order for us to go towards the best quality life possible, everywhere when failure happens in some elements of not providing that best quality care, everyone who is involved, either professionally, personally, socially, or financially, or in any element of these best supportive healthcare practices or best supportive quality of life practices, anywhere we are failing, those places individually also we have to resolve, and sometimes collectively also we have to resolve. For air pollution, water pollution problem, it's a collective resolution also, along with individual specific resolution that has to emerge. In food related quality also, again, a collectively we have to start demanding good quality food. Businesses have to start waking up, farmers have to start waking up to what practices that have been normalized so far is harmful, that needs to change. Hospitals also might have to wake up that while they have been doing a normalized practice of keeping a clean bed, keeping a clean hospital environment, there are still places in the operational policies, in the environmental factors related to the place where they are operating. All of these are also going to impact the quality of health of the patients they see. The doctors, if doctors live in denial that environmental health factors, the supportive health factors, the life circumstances of a patient is going to cause them to ask for a surgery or deny a surgery, take the option of a surgery, not take the option of a surgery, all these things a doctor also has to start realizing. If you're a good quality doctor, if you've watched Grey's Anatomy, in Grey's Anatomy, some of the doctors sometimes understood the patient's problems when patients don't have insurance, when patients don't have the financial condition to do certain things. So they were doing this analysis of risk-benefit analysis for a patient, and it's a TV show. But that's also a reality of what a good doctor should be like, when they are able to see beyond just the disease of the patient, but look also at the socioeconomic factors, socioeconomic status, social life, abuse related parameters, and all these other ancillary factors that will drive or harm the recovery of a patient. If you have a lot of if you have an abusive spouse, can the doctor give you a medicine where your abuse will now get escalated or hidden more? Or should the doctor, those calls also doctors sometimes have to make, it's an ethical call, but the better quality doctor you are, you will make the better ethical choices. If you are a poor quality doctor, and not just doctor, you could be a doctor, you could be a technician, you could be a nurse, you could be a nurse practitioner, you could be a different kind of a healthcare professional, but your expertise or evolution as that professional is dependent on how deeply you practice your profession, how rightly and in a balanced manner and ethical manner you practice your profession. So I was just practicing my profession in a most balanced manner, even though I'm not doing a job as a pharmacist, but as a past healthcare researcher, as a past pharmacist, as a past and as a present patient, I had to know what is the right way to heal myself. I had to do what is the right way and what is the wrong way to heal myself. Whichever ways are misaligned with the current life circumstances can't be practiced. If I don't have water and the medicine they are giving me requires more water, I have to deny taking that medicine. I can't take that medicine. It's not an insane choice. It's the wisest choice, because the medicine won't work if the medicine's effect will be most effective only when right water, right levels of water needed to do the healing is present. And it doesn't matter whether I'm talking about a medicine that needs water or an energy healing that needs water. The primary problem, earth pollution related to water pollution, at least needs to be solved. But is that the only thing that needs to be solved? No. Earth pollution, water pollution, food pollution, air pollution, clothes pollution, life pollution, environmental factors related pollution, social factors related health harm, psychological factors related health harm, financial factors related health harm. All of these could be involved in one particular patient's life, or if not one out of 100 patients, at least 10 patients will have all of these factors. Another 10 patients might have one or two of these factors. Another 10 patients might have only one of these factors. And if a doctor only looks at that patient who has only the health factor and none of the other factors, you are only going to be able to help and serve those patients who have only one health problem. You won't be able to. And when we do a textbook analysis of any disease condition, initially 100 years back, 50 years back, every disease that was studied was based on only one particular disease's prominence in someone's body. But right now, because earth pollution is so high, usually patients have multiple diseases going on, multiple health harming factors prevalent in their lives. So a more deeper approach, more intuitive approach, also more wiser approach, all of these are also needed as the right way to practice medicine and right way to actually help a patient heal and recover. So I hope this was insightful, and if you have any other questions and anything I spoke here is asking you to get some further clarity on these topics, please drop a comment and I'll try to reply back with another video or a reply. Thank you. Have a great day.